Karlo with ESPN Los Angeles on the Hogue Road to Recovery, presented by Hogue Orthopedic Institute. Proud to be joined by Dr. Alan Beyer. And Dr. B, I mentioned the bat signal went up last night on some devastating news, a tough blow for the women of Troy. The Trojans witnessed their star player, the presumptive National Player of the Year, JuJu Watkins, going down with a torn ACL on a fast break, dribbling up, defended by two Mississippi State players, and all the weight pushing into her right knee. You could see she was in absolute pain. We actually have the video of the play right here playing. Dr. B, when you saw the injury, what did you think?
I kind of thought that what it is. It certainly was consistent with an ACL tear. I wouldn't be surprised with the degree of impact if she might have also sustained a little bit of a contusion or maybe even slight fracture of the tibia, which can happen with this injury as well. That would explain the great deal of pain that she was in. A pure ACL very often doesn't hurt that much right away until it swells over the next few hours. But she was clearly in a great deal of pain, which makes me think that she might have also sustained an injury to the bone as well, which will not impact the outcome or the long-term result, but certainly did hurt her more at the time of the injury.
Dr. Beyer, can you help put us in her Nikes, in her shoes, and what is that pain that she felt right there?
Well, it comes from several things. Number one, when you tear the ACL, the femur and the tibia are no longer as firmly hooked together, so one can kind of sublux forward on the other one and stretch some of the other soft tissues around, and that causes some pain. And also with the impact that she sustained, as I suggested, there might be a bony contusion and some edema in the bone, possibly even a fracture. You often see small little fractures of the tibia associated with an ACL injury, which would increase the pain as well. So I think all that's on the table. I haven't seen the reports of what her MRI scan showed yet, but I'm sure that'll be out within the next 24 to 48 hours.
She was carried off the court, could not bear any weight on it. After she was carried off the court, she exited the arena. They didn't have an MRI machine at the Galen Center, and that's where the MRI confirmed the unfortunate news. Doc, you mentioned the swelling. I'm curious about that. How long do you wait for that swelling to go down before you actually operate?
So most of the conventional wisdom in orthopedic surgery now is not to go in right away within a day or two and do the surgery unless there's a terrible fracture like a dislocated knee where you have to put it back together. But most people will say, wait a week or two, ice it, start it moving so it doesn't wind up too stiff after the surgery. And maybe at 10 days, 2 weeks, you think about doing the surgical repair. Or actually, it's a reconstruction, not a repair. We actually build a new ACL. We don't repair the existing ACL. That's not really surgically very feasible because it doesn't have a very good blood supply.
So repairing it, where do you get that from?
So there's a number of different places where we can take tissue to build a new ACL, so to speak. In the old days, it used to be a bone patellar bone graft, a piece of bone from the kneecap, a third of the central part of the patellar tendon, and a piece of bone from the tibia, and that made the new ligament. Then we moved to hamstring tendons, semitendinosus, gracilis, sartorius, which were less traumatic. They didn't involve cutting any bone at all, but did sometimes leave the hamstrings a little bit weak. Of late, the last number of years, a quadriceps tendon, a portion of the quad tendon, which is above the patella, we take a piece of that and have anchors that can anchor that into place to rebuild the ACL. And it's turned out to be a very, very solid, reliable repair without leaving anything in terms of a deficit down the road when the rehabilitation has happened. Occasionally, but this is more often in a redo surgery when they've torn it a second time, we'll use an allograft, which is usually bone patellar tendon, bone or Achilles tendon or some other tissue from a cadaver, and use that to rebuild the ACL. But we prefer to use native tissue, less risk of any kind of rejection phenomena, less risk of infection, and it's more easily vascularized. The body accepts it better than tissue from another source. So my guess would be she's probably going to have either a hamstring or a quad tendon repair.
That's unbelievable because we hear about ACL injuries and torn ACL surgeries all the time. So we really appreciate the actual insight that goes into it. So, as I mentioned all the time, we just saw Kyrie tear his ACL on the court for the Mavericks, and obviously everybody's injury, it's an individual case by case basis. Kyrie, a male, JuJu, a female. Kyrie's a little bit older. JuJu's a young female in college. Do you approach those procedures the same way?
Well, before we even talk about how we approach them, let's talk about the epidemiology. There's a lot of research on ACL tears in female soccer players because the incidence of torn ACLs in females is much higher than the incidence of ACL tears in males in soccer. Bert Mandelbaum, who's up in Santa Monica, has done a lot of research on this. And it turns out that anatomically, the intercondylar notch, which is the space in the femur, is narrower in females than it is in males. So it's less able to tolerate a significant twisting injury without impinging against the ACL and possibly tearing it. So this anatomic variant translates perfectly well to basketball. Clearly, if there were as many female basketball players as there are males, we would be seeing more ACL injuries in female basketball players than in males. But basketball is still a male-dominated sport. So that's why this has never come up. But the research is very clear. Women are anatomically predisposed to tearing their ACLs with these kinds of twisting injuries. As far as treatment, I think it just all depends on the surgeon's preference, the size and weight of the patient. Obviously, I'm going to use a different graft in an offensive lineman in football who weighs 300 pounds than I am in a more slight female whose bony structure is smaller as well. So I think that it's likely that she'll wind up with a semitendinosis or a quad tendon repair as opposed to a bone patellar tendon bone reconstruction. But surgically, it's really the same operation. It's independent of the patient's sex.
Now, looking ahead at JuJu's future, again, this is a tough blow on USC's season immediately. They are still alive in the tournament. We'll play Saturday against Kansas State up in Spokane in the Sweet 16. But now we're thinking about this individual athlete and the future of her career, where she may miss, and correct me if I'm wrong, torn ACL, that usually means a 9-month to 1-year window, correct?
6 months minimum. 9 months is probably more realistic.
So
we're looking at New Year's. We're looking at New Year's.
So fast forward then, and you're talking about it's in the middle of next women's college basketball season, and even leading up into the tournament, if it is a longer recovery, say 1 year. Do you think there's a possibility of JuJu maybe redshirting the season and maybe skipping out on just playing at all next year?
It depends on several different things. I think it depends on where USC is in terms of what are their chances for going deep in the NCAAs next year. If come December or so and her rehab is progressing very nicely and they're in the thick of things, there's a very, very strong possibility we'll see her again next season. If the season is not turning out to go USC's way, or her rehabilitation for some reason has been somewhat slowed or come along more slowly, we might not see her play. And I'm not sure exactly when that decision has to be made if she doesn't take the court. The other thing to remember is, great an athlete as she is, and let's say she has an absolutely astounding recovery, talk about February that she hasn't played with her teammates at all by next year. How much is she going to integrate into the offensive scheme of things? You can't just whip somebody up and throw them in there and think that it's going to be like a seamless meshing of the gears and everything's going to be hunky-dory. You got to play with your teammates, kind of like what LeBron is planning on doing the rest of this season, right? You got to play with your teammates and stay fresh and be in the plan, in the game plan. I don't know if that's going to be possible depending on how her rehab goes.
Not to mention, this is college, very different, where you have incoming freshmen like top recruit Jasmine Davidson coming into USC and meshing new freshmen with star players who need the ball like JuJu Watkins to be the superstar that she is. With JuJu, obviously looking at her future, with the WNBA rules the way that they are, she wouldn't be able to go into the WNBA draft and go pro until 2026. So that would be the year after next. So again, Doc, this is a tough injury to see with anybody, any athlete, especially a common one in basketball players. Is there any preventative measures that you would recommend for basketball athletes like JuJu to avoid ACL injuries?
So great question. And Dr. Mandelbaum has also done some great research on this and has actually come up with a program for female soccer players to do in terms of selectively strengthening certain muscle groups to protect the ACL. And I have a feeling that most big time basketball programs have probably incorporated exactly this same exercise program into their conditioning and training program because it's universally accepted. Nobody can argue with the results and the benefits of it. So I have a feeling that she was already doing everything that could be done to minimize the risk of this injury.
And what are some of those exercises?
Well, it's to selectively straighten certain motor groups to try to fire a little faster, to protect the knee if it comes across a sudden impact or a sudden twisting injury. You train the quads or the hams to fire a little bit faster. You strengthen the abductor group, which is around the hip a little bit, and the adductor group, which is on the inside of the thigh, just to kind of protect the knee by getting the muscles a little bit stronger.
Doc, thank you very much for that insight. I think a lot of athletes, especially basketball players, can take that to heart if they're not, like you mentioned, practicing it already to strengthen the muscles around their knee. Doc, thank you very much for joining us on the road to recovery. It's a tough one for USC and for Trojans fans in general, but I think we'll stay optimistic for JuJu's future and the Trojans' run into the madness.
Sometimes an injury like this can motivate a team. I don't know if it can motivate them all the way to the Final Four in the big game, but we'll see how it turns out.
Yeah, we'll see what Coach Gottlieb and Kiki Iriafen can do in the Trojans. Doc, what's going on Doc in the Dugout this weekend?
Doc in the Dugout's been busy. Last week, we spent the whole week at the Hogue Classic down here in Newport Beach. Congratulations to Miguel Angel Jimenez, the ultimate champion of the event. The crowds were great. We had Jack Nicklaus at our breakfast. Doctor in the Dugout won second place in the Pro-Am, which was a big surprise. This week, we're dark because there's an Angel game early this week. The Angels are on the road. So this Saturday, we will not have a Doctor in the Dugout broadcast, but we'll be back first weekend in April, bigger and better than ever. So listen for us then on AM 830.
I have a feeling Road to Recovery is going to make a stop at opening day soon, right around the corner.
Let's hope that you don't need Doctor in the Dugout to talk about anything that happens on opening day.
You're right, Doc. Thank you very much, and thank you for joining us on the Road to Recovery, presented by the Hogue Orthopedic Institute. Thanks, Dr. B.
Thanks, Karlo. Thanks, Karlo. See you soon.